Welcome, everybody, for another edition of Practice Perspectives. I'm Paul Henny from the Bob Barkley Study Club, and I am super excited to introduce you to Dr. Emily Stein today. Emily Stein is not a dentist. She's a PhD microbiologist, and through undergraduate studies at the University of Iowa, and went on to get her PhD at UC Berkeley, and then did postgraduate work at Stanford. So she comes to us from a different perspective, and she has came up with some ideas and developed a product that she ultimately patented that I believe is going to change dentistry as we know it. I think it's slowly in the process of doing that, but it is sort of the concept that we kind of discussed back when I was in dental school many years ago, that at some point somebody was going to invent a vaccine that was going to eliminate decay or periodontal disease. And of course, that day never came until Emily came along, and it's not a vaccine. It's an even better idea than that. So we're going to explore what Emily has come up with and created, and that I'm using personally. My co-host here, Stan Kingma, is with us as well. Stan is using Emily's product as well, so we have two active users of your product. And I think I've told you that I can't even keep it in my office right now. It just flies out the door so quickly. I have a hard time even keeping it in stock. So what the heck am I talking about? I'm talking about a concept called a prebiotic. And most of us are familiar with probiotics, which are kind of nutraceuticals that have active bacteria and yeast and so forth in them, really intended to, and you can jump in and correct me at any time, Emily, because I'm on thin ground here with my knowledge. But probiotics, I think most people are familiar with those. They're commonly used to rebalance gut bacteria, particularly after you've been on a long course of antibiotics or something like that, to create a dysbiosis. So we have the same thing that can happen in the mouth. We can have an oral dysbiosis, and probiotics have been developed for that as well. And Emily's going to share with us how that concept really doesn't work very well. So in response to that, Emily developed a prebiotic, which is is it fair for me to call it a nutraceutical, Emily?
Yeah.
Yeah, a nutraceutical that basically influences the behavior of bacteria in positive and negative ways. In other words, it helps manage down selected bacteria, pathogens. It helps balance the pH so the environment is more favorable for the bacteria that we want to prosper and rebalance. So it's an idea of rebalance the oral bacteria without having to nuke it with things like fluoride and all the other things that are in the oral care products today. So we want to get into that territory too. So let me just be quiet here for a moment and let Emily introduce herself and talk a little bit about her concept, which is called Daily Dental Care Lozenges, although she's developed some powder forms and other things, and she's even taken it into veterinary medicine. So why don't you go ahead, Emily, and just tell us a little bit about yourself and what you've done.
Thanks, Paul. So I never thought I was going to get into oral care. My grandmother had a stroke one day from a tooth extraction that she'd had the day before, and that's really what woke me up to the struggles that as we age, a lot of folks have increased risk factors of developing gum disease. And my grandmother fell prey to that trend, and she was suffering silently in assisted living, and her rheumatoid arthritis was so progressed she couldn't manage her own oral hygiene effectively. And it turns out that cardiovascular events are the number one risk factor if you have gum disease. So my grandmother was a statistic, and that really fired me up. And I literally flew home and I grabbed her oral biofilm because I knew that was the culprit. You know, when you pull a tooth, anytime you see blood, imagine millions of microbes going into that circulatory system, and they'll set up shop either in a joint, artificial joint. In my grandma's case, they went up to her brain and she threw a clot. And that changed the trajectory of her life completely. And so I didn't want her to have any other dental problems because my PhD work was focused on how microbes work together in these communities called biofilms, and how they survive exposure to heavy metals, radiation, exposure to antibiotics, antiseptics, nutrient deprivation, what they do to survive. And so I used that knowledge paired with my rheumatology at Stanford, which is heavy duty on immune surveillance and immune activation, which interestingly, periodontal disease has a lot of hallmarks of an autoimmune disease. Polymicrobial signatures that lead into immune activation. Chronic immune activation leads to deterioration of tissues, which is why the periodontum gets degraded over time. It's both microbially driven process and immune process, which is why, fluoride doesn't work, and which is why minocycline doesn't work, and which is why all of these approaches that have been developed over the past 50 years and implemented are not working. And so that's why I had to take a fresh lens to try to understand what the real underpinnings of the problems are. And a lot of it's our diet, and a lot of it is everything is processed, and there's so many preservatives and everything. And let's just be honest, sodium fluoride is anti-cavity, but it doesn't do anything for gum disease. And antibiotics don't work either because microbes become resistant to it. And so we have to find a better approach. And that's where I looked at the probiotics that were under development, and all the research and clinical studies shown don't have any statistical significance really in impacting disease course in other kinds of diseases like ileal inflammation, colon inflammatory diseases, autoimmune related gut diseases. Probiotics don't really tend to have efficacy, and a lot of the oral studies that have been done, they're not been able to find significant efficacy either. And the reason is you're already coated with that biofilm, and introducing new microbes to that, they just kind of pass on through and provide transient, if any, benefit while they're inhabiting the oral cavity or the GI tract. And so we're really taking a very different approach, and we're taking a patient's own biofilm, however dysbiotic it is, which means it's really kind of screwed up. There's too many harmful microbes. The kinds of activities that biofilm is making is causing a lot of inflammation. They're secreting a lot of things that make gums and gut epithelial barrier leaky. So you get leaky mouth, just like you get leaky gut. And you get a lot of recruitment of immune cells into that space, which causes, obviously, gingivitis, gum disease, and other kinds of chronic diseases that can lead to cancer and whatnot. And so what we're doing is just putting the microbes on it. We're using nutrient pressure to apply to the grandiose universe that lives in the oral pharyngeal cavity. And we're putting them basically on a keto diet because it completely changes who lives in that space, what they eat, and what they secrete.
So let's just back up a little bit. Let's just talk about what's in our mouth. Trillions of bacteria, mucus, and bicarbonate, and proteins, and enzymes, and all kinds of things. So that environment in its most ideal form, in its most balanced state, doesn't have a proliferation of pathogens like strep mutans and others, but it's altered essentially by our diet, as well as our other habit patterns. Our toothpaste, our mouthwash, other things like that are suppressing certain things and promoting other things and creating dysbiosis. And in many cases, we don't even, we can't see that on a clinical level very well, but it's happening. Many of the patients that come to us are in a state of dysbiosis. And your idea is a way to bring back balance to that system. It's not, you're not really eliminating pathogens altogether. You're just pushing them down to a level that your body can manage it, as it's always done before all this other chemistry kind of came on the scene. And so, normally there's a tremendous amount of diversity in the microbiome of the mouth, but that all these things alter it. So this is what's, I think, brilliant about your idea. And maybe this is a good point for you to kind of elaborate a little bit more on the difference between your idea and some of the probiotics that have been brought into dentistry.
Yeah. So because all of the attachment points in the mouth and below the gum line and on the tooth surface are all coated already with someone's microbiome, even if it's a dysbiotic, which means too many harmful, not enough beneficial, there's no space for those probiotics to attach to actually have an effect. And so they just get swallowed and honestly defecated out. It literally is money down the toilet. And so our approach is very different. We're literally coming in with active ingredients for the diet to influence what microbes eat. So they're eating our ingredients, changing their metabolism. We're basically telling them to stop eating carbohydrates and eat protein instead. And that surprisingly has a profound effect. And a lot of the pathogens that inhabit the mouth, Candida, Aspergillus, on the fungal side of the spectrum, multi-drug resistant E. coli, streps of all sorts, Staph aureus even is in the mouth prevalently these days. Those guys are sugar eaters constantly. That's their primary nutrient source. And so they're able to eat. You have one Cheeto, and the microbes in the mouth are able to easily start breaking that down immediately because of all the enzymes they've secreted to just capture some of that food. And then once it gets digested in the gut, it recycles through the bloodstream in a much more activated form, that carbohydrate. And so it circulates back in the crevicular fluid and saliva, and then the microbes feast again, right? And so that's why you can take an entire mouth and expand it based on someone's diet. If they're eating too many carbohydrates and processed foods, they're going to get dysbiotic really quickly because they're selecting for microbes that eat carbohydrate, which sadly causes cavities, and sadly carbohydrate fermentation makes acids, and these organic acids feed the asaccharydic anaerobes that are driving that gum disease process. So we're trying to just basically recalibrate who lives in the mouth and what they're eating through dietary influence. And this is just an example of dysbiosis. This is I took a subgingival swab sample from patient with advanced perio, and you can see how enriched it is for one type of species, right? And gram-negative anaerobes, and some gram-positives, but mostly gram-negative spirochetes. And then, on our treatment, that dog, it was a dog because they tend to have really, really advanced issues. So this is a half a dose of our approach, and this is a full dose of our approach. Is an example of changing the diet. There's no antibiotic. We never use fluoride. I mean, there's fluoride in water, right? That dogs drink every day. That doesn't help.
Right.
And this is just an example of just changing the diet can fundamentally influence who lives in that biofilm, what the biofilm is built from, and what the microbes are secreting.
So even in a case, so let's make sure I understand this, because and this is sort of supported by the study that you did in the memory care unit, which we should probably get into a little bit as well, because this is not just chalkboard theoretical stuff. Emily's done some clinical research that supports what she's talking about here. But even in a patient that hasn't been completely, their biofilm has not been completely removed and deplaqued, your product can actually penetrate that over time and rebalance everything in spite of that. I think this is what makes your idea so powerful. Maybe just talk a little bit about the cohort study that you did on the memory care unit. I think you did there was another group also involved with younger patients that were in orthodontic care. Is that correct?
Yeah, absolutely. Yeah. So really briefly, and just biofilm 101, you can scrape off what you can visually see, but there's so much more biofilm that you can't see, that you can't access, that you can't ever eradicate through traditional approaches, because they're living in the alveolar bone of our jaw. I mean, we were born with them. They are in the womb as we develop. We foundationally are microbial. And so the goal is, wherever they are in the head and neck area, I want to be able to influence who lives in the head and neck. And the only way to do that is through their own language. And so they eat constantly. Microbes don't sleep. They do have circadian rhythms where they're more metabolically active and less metabolically active, but they don't sleep. They don't die. They're really cool they're really cool. And so you just basically, we're using nutrients that penetrate all biofilm. They even have the receptors, and they're like fishing poles that pull in our own ingredients through super thick subgingival plaque. We've demonstrated, and other academic groups have demonstrated, that the capability and the robustness of microbes living in these huge communities. And so that is so important when you're thinking about vulnerable populations. And Paul, you mentioned some of the studies we've done. We've done older adult low-income minorities with gingivitis. That those folks they go to the ER when they have a dental problem. We showed that we could stop their bleeding gums in 60 days compared to the placebo control. We've done Alzheimer's / memory care studies with a mobile dentist group up in Northern California. That was a 4-month-long study. We showed that we could significantly eradicate or significantly decrease multi-drug resistant microbes, Candida in these patients' mouths, karyogenic microbes, gum disease pathogens, and those results were identical to the kiddos that were in orthodontic chairs, either with braces or aligners, and actually one of our serious cases was a multi-drug resistant Candida species that we cultured up from a 17-year-old orthodontics patient. Luckily, our approach eradicated it from his mouth, but my goodness, it's one of those new scary emerging Candida strains. He had it living in his mouth, and it was at really high amounts. And it's just an example of you don't know what's living in your mouth and until it's going to cause problems. But my point is once the disease process progresses beyond a certain point, it's a runaway freight train, and there's nothing that can be done. We don't know how to grow back periodontal ligaments. We don't know we try to build back tissue when the gums recede, but that's still kind of a losing battle. So there's years of and months in many months where you could interrupt that disease process or prevent it even from occurring. And the simplest, easiest way is to just change the dysbiotic profile in someone's mouth.
So basically, yeah. Stan, do you want to say something?
Yeah, I'm just from a layman's standpoint, a person with a mouth. The reality is that the mouth is evidently a highway to all kinds of diseases that I don't think we realize as lay people, and also I don't think we realize how dirty. I mean, we're always putting stuff into the mouth, and then when we add the sugars that you're explaining, it's a horrible place. And I don't think the general public understands that.
Yeah. Well, you've always heard the term sugar kills, sugar kills, sugar kills. It actually really does. It leads to cancer. It leads to chronic inflammation. It leads to all these things. It's because our diets fundamentally dictate who lives in us. And so a diverse diet with a lot of vegetables is something that we're always taught, right, in grade school. But we're always on the go. We're grab and go, and this whole fast food culture and packaged foods is really
full of chemicals. My goodness,
it's really created this dysbiotic population, and so it's an epidemic. And the number one biggest downstream, grandma was the statistic: cardiovascular events, stroke, atherosclerosis, and heart disease are the number one risk factors for periodontal disease if you have perio. The second thing is metabolic, so type 2 diabetes, obesity. Those are directly epidemiologically strong links. And then the third is premature birth. So females with bleeding gums need to worry because microbes go into the circulatory system and they can easily penetrate the placenta, and they coat. This is now being shown over and over and over again in animal models and in healthy women or women with gingivitis, have very different miscarriage rates or premature birth rates or low birth weight rates compared to women that don't have bleeding gums.
So from a general population health standpoint, this is huge, what you've done. This is huge.
Yeah. Believe it or not, our nursing home studies have shown us that there's a link somehow between the mouth and the urinary tract. And I don't know how direct it is yet. We're still doing studies. And we've just finished a 15 patient study where we put them on our oral care product and did direct administration into the genital urinary cavity. And we grew lactobacillus in women that and got rid of their E. coli and yeast, which is a big culprit. The same thing we're doing in the mouth with oral dysbiosis, we can do in other locations too, which shows true potential in this applicability.
So essentially, you're screwing up the metabolism of the pathogens that are causing these problems. And as I understand it, the key way that you're doing that is with cyclodextrin, right? Mm-hmm. Which is a fiber that found in nature. Is that correct?
Yeah, it was discovered in the 1800s by a German microbiologist. There's soil bacteria that make it naturally to actually block other microbes, because they're just competing for nutrients, right? So they secrete it naturally to outcompete other microbes that like sugar.
So even, our modern day diet is so overwhelmingly overloaded with too much complex carbohydrates. That's driving all of the things that you just mentioned to a very large degree, because metabolically we really don't have any need for any of that. But our body attempts to adapt in all these dysfunctional ways, which cause kind of self-destruction to a large degree. So here's a question for you. In the presence of a person who really has not optimized their diet to minimize the presence of all those refined carbohydrates, if you add in cyclodextrin and the other elements of your product, which include vitamin B6 and other things to rebalance pH and promote amino acid utilization instead of utilizing the carbohydrates, is it still work in that kind of environment? They need to use more of it, or can they overwhelm it with just too much complex carbohydrate? What happens in those situations?
Yeah, you're bringing up the struggle that we find ourselves in on a daily basis, because we're having to troubleshoot people's diets, honestly, and their dose and advising on dose based on what their dietary intake is. And the best example is what we're seeing in dogs, where kibble is just chock full of rice and wheat and all of these chickpea, all these carbohydrates, right? And dogs don't get their, like 2% of dogs get their teeth brushed. It's ridiculous, but you see such effect. And yes, just a scoop of our active ingredient in their drinking water can have a profound influence. But sometimes it's not enough, because they're getting fed greenies or, all these other treats throughout the day too. So it's a constant battle. And to take it back to the human, we advise patients or everybody to take it after they brush their teeth, before they go to bed, because when they're sleeping, microbes are just churning out tons of acid because they're feeding off of all the sugar and dietary, all the stuff that's gotten metabolized and absorbed in the gut. It's being circulated back into the saliva, and those microbes are just spewing out those acids and growing, which is why you wake up with morning fuzz, and morning breath, is because those are all products of sugar fermentation pathways.
So I've been advising my patients to use it, when they're initially starting with your product, to use it 3 times a day. And one of the questions that I wanted to ask you was, after a period of, let's say, 60 days, and they have a reasonable diet, this isn't, an off the bell curve kind of person. They're actually pretty good at maintaining oral hygiene, and they're reasonably good about keeping the carbohydrates within a relatively normal range or acceptable range. Is it likely that person can just use the product 1 time a day in the evening before they go to bed, or they think the 3 times a day is probably the best way to go?
Yeah. So sadly, I haven't come up with a better approach that's more durable, because the microbes, they work really quickly. They're so good at eating carbohydrate if it's there. So the more frequently throughout the day you take it, the more trained they are, if that makes sense. But if you only could take it once, take it before you go to bed. That's take it after chase it. Think about it as a chase after you just had ice cream or something like that. Something that's really broken down in carbohydrates, I would chase it with a lozenge, or we're coming out with a water additive too. So just, mouth rinse or whatnot.
So one of the things that you shared at the seminar that I attended, and this happened to be this past April, I didn't know that Emily existed. I didn't know this product existed. And I sat there with my mouth open for like an hour going, "What? You did what? This does what?" But you have developed essentially what experientially are just mints that dissolve in your mouth. And you've also developed a powder product that can go in your drinking water. So if you're a bottled water person, you can just sip on that all day and achieve the very thing that Emily was just describing. And just to give you a little bit of a pitch, her talk about using this product with dogs isn't just a random conversation. Has the patented product for that she sells right now. You can get it on Amazon. It's called Teef, right? TEEF.
Yeah. Teef.
So you can buy that. If you got a dog with bad breath, or your veterinarian's telling you that your dog is trending towards periodontal disease and needs treatment, the intervention is right here. This is the product that exists right now. You can buy it today.
Yeah.
So Emily's had a unusually challenging time getting this product into dentistry, which she initially developed in 2013, something like that, and eventually got the patent several years on. But maybe you should talk a little bit about your experience with dentistry. Why isn't this product in every dental office and every public health clinic and every nursing home? Tell us why.
In every kennel. I mean, come on, this is amazing.
In every kennel.
Yeah. I know. Yeah. We're in process for, it's complicated. I mean, nursing homes I thought would be the easiest. It's complicated with the regulations and all of that. But we're working on it. And now we have we're armed with some really good partnerships that will take some time, but we've got the stakeholders aligned, and we've spent 2 years of our lives and a lot of money and a lot of time going to dental conferences to tell people, look what we just did and look what these clinical results show. And people would avoid me. Dentists would avoid me because they didn't want to have a conversation with me. And, and this is, it's funny, they want to invest in our company, but they don't even recommend our product to their clients because the risk reward, the fear that it might really work, that they might miss out on their bottom line. And so coming in from a perspective, instead of how do we work together to show them that it's a value proposition for prevention that can actually make them money, is kind of where we're still learning how to do it. But honestly, through Dr. Larkin and stuff, he came to us. So that was unusual, because normally we've just given up on dental as a segment. We focused on orthodontal, which is why we've done year-long studies on hundreds of, ortho kids. And we've gone to mainstream, more oncology and hospital systems, because there is an importance, and they recognize the importance of a prophylactic cleaning and a clean mouth going into surgery or going into radiation or chemo. And so those are the areas we've been pulled into through our dental product, for instance.
So let me reframe this, or put it another way. Emily's idea is an existential threat to the current sickness-centered dental business model. Okay, that's why nobody was interested in her product now, and that's why I have Emily on this program today, is because obviously I'm associated with Bob Barkley's work, the Bob Barkley Study Club. The central theme in Bob Barkley's teaching and writing and everything, professional life, was all about prevention. And we finally have a product that actually can deliver on that promise. And we have an opportunity, if you understand what she's done and know how to apply this very simple idea, brilliant but simple idea, you can turn your practice from being just reparative and reactive to be a leader in health-centered dentistry and whole health living, which is what Tom Larkin's work is all about. And I'm super excited to say that Tom's going to be at our next study club meeting in October 6 and 7. I'm hoping Emily will join us as well, and she can actually get down into the weeds a little bit more on this amazing idea and topic. And we'll even have more, hopefully have some more research data to even back up what she's already proven at that point in time. And this one idea is completely a paradigm busting. And I know a lot of people are sick of the word paradigm, but it's absolutely appropriate here. We in dentistry are stuck in a paradigm that's got to go away. And we got to move on to a more health-centered approach that includes the microbiome all the way through to how people breathe at night or don't breathe at night, to everything, their diet counseling. So we've got to transition away from being too centered to whole health centered. And that represents a tremendous opportunity for the dentists that understand this area and know how to apply the knowledge. And I see Emily as an absolute integral piece in that transition for all of you who understand what I'm saying. Emily, any thoughts on that?
I am excited, so excited to be part of that conversation. I've been wanting to have that conversation for a long time, because I don't want any other grandmas and parents to go through what my grandma went through.
Yeah, it's so, I've been practicing dentistry for a long, long time, and I have a handful of patients that I have not been able to, and a lot of them are quite meticulous with their home care. Mm-hmm. And yet we are fighting, progressive decay problems because of the antihypertensives they're on. They've got a dry mouth. Maybe they breathe through their mouth at night, other things going on, maybe some issues going on with their diet that they're not totally revealing to us. But finally, I'm feeling like I've got something I can hang my hat on, and I can offer these people that's actually a true solution. Mm-hmm. And it's what I really even like about it more is that it's empowering to them. It puts them in the driver's seat. It allows me to educate them more about how this whole dysbiosis comes into being and what their role in it is and what they can do about it in a very simple way. Yeah.
And honestly, the mouth is the biggest, most important portal to the entire body.
Yeah.
And what if the more clinicians can work on preventative care instead of restorative, which again is too late, those microbes have already left the train station. They're in distal places in the body, causing more problems. And Porphyromonas in particular is linked to Alzheimer's. It's linked to atherosclerotic plaque formation because it can burrow through blood-brain barriers and your carotid artery and cause massive inflammation wherever it goes because it's very pro-inflammatory. Kidneys as well. So there's the more you can do to actually prevent the microbes or to grow the better ones, to stop the harmful ones, and to keep that mouth in tip-top shape, the healthier and the longer your patients will live.
Right.
Well, this is huge for the whole medical community, for the whole world of medicine and health and diet and
dentists
huge.
are at the front line. They're at the front line.
Yes. So it represents, I understand it's an existential threat to the old way of thinking about things, but it's a massive opportunity for a new form of leadership and a deeper level of engagement with people and a higher level of stabilized health, and in an intergenerational way. You can get these into the family units, which is usually a lot of the source of the cross contamination, if you will.
Oh yeah.
So it's a complete game changer. And I honestly haven't been able to stop thinking about this since April. Every day it's like on my mind. How can I help Emily out? Because this is just paradigm shifting, again, to use that word.
Yeah.
So I would like to invite everybody to consider joining us at our workshop here in Roanoke and up on Bent Mountain in October. It's October 6th and 7th. And Stan will be here as well, as always, doing interviews and recording. But I've got David McCarty coming in, who's a sleep medicine certified medical doctor. And he's going to talk a little bit about sleep apnea and the complexity of that diagnosis. All of these things are so highly interrelated. A person breathing through their mouth has a different microbiome than a person that is able to breathe through their nose. All these things. So we're going to go into these topics in addition to spending a lot of time talking about co-discovery and how we can apply that to a practice, which really means how can we develop more effective relationships with our patients so that they over time make better decisions and move towards higher levels of health instead of being stuck in this kind of dysfunctional codependency that patients have with both the medical community and the dental community, and just coming in for repairs, and there's no resolution to it. It's just on and on and on, and we all have seen that frustration with people, the amount of money and time that they spent on dentistry and dental work, and it just leads to more and more issues, and they get frustrated to the point where that someone just decide to have all their teeth taken out and implants placed, and then we go through the same cycle again with failing implants. So this idea is just I still have a hard time getting my arms around it. It's so important, and so.
It's simple too,
and it's brilliantly simple, and it's easy. Every patient that I have put on this product is following through because it tastes good. It's easy to integrate into their lifestyle, and I think once we get the powder that they can put in their water bottles, the compliance rates can go higher.
Yeah.
So I see nothing but improvement on the horizon for all the people in my practice and everybody that I can influence. So that's my game plan right now.
Great. Well, Emily, as a professional interviewer, I'd like to just see your reaction to seeing and hearing a leading medical professional get excited about your product. What's that mean to you?
Personally, professionally, it makes me so relieved, and it makes me happy, and it makes me feel like my grandma's struggles are worth it. like, maybe it gets me emotional, really emotional. Yeah, it's very meaningful. It's hard to talk about without crying.
Why is it that our whole medical profession is so evidently resistant to these kinds of ideas? You can't be the only person in the world who has something that is exciting and new that can't break the barrier. Well,
there's so many millions and billions tied up in big pharma that I've had my friends startups. They did licensing events with some of them, and they just shelved it because it was such a threat. So
a company will get the rights to the product and shelf it?
Yes, that's happened so many times. I can't even
Unbelievable.
Because status quo we're all living in a capitalistic society. And so status quo, you can place bets on that in the stock exchange, right? Status quo. They don't like change because it's hard. And so people care about market share, and loss of market share is frightening. And I get it. I understand it. And which is why we're not going into toothpaste anytime soon. There's no way.
Yeah,
we would be annihilated.
You could wipe out that market.
Yes.
And who wants that? I mean, everybody except the toothpaste people.
Yeah, and lozenges for now.
Yeah. Well, Paul, I think this is perhaps the most meaningful conversation we've had in this series. Unbelievable information, Emily.
Yeah. It really is. And so, Stan, when we do the post-production on this, I want you to put her website information up there so that people can order that. And then again, I really would encourage people to look into maybe attending our October meeting. It's a great time. I've got some really top tier dentists from all over the country coming in that are going to be discussing how they applying co-discovery in their practice. And then I'm integrating this in with Emily's work, and Tom Larkin's going to speak, and David McCart. This is going to be an amazing meeting. I'm so anxious for that day to come. It's going to be great.
You may have to build a bigger facility, Paul. I think this is really going to take off. Final thoughts, Emily. We normally try to keep these conversations to 20 minutes or so. We've been talking 43 minutes, and everybody is going to be interested in this. Final thoughts. I mean, help us with a final wrap up, both you and Paul professionally. Let's start with Emily.
Yeah, from my side, I want to be in everybody's mouth. How do we achieve that? I think we'll have a better healthcare system that way. I think our insurance premiums will go down, which everybody will like, and higher quality of life for everybody. And I still believe that dentists will have flourishing businesses. So I don't know how to achieve that, but I'm looking forward to having conversations about it.
Paul, your wrap up.
Fantastic conversation, Emily. It's as good or better than what I was imagining. And I look forward to the continuation of this conversation with others as they learn about this and as they figure out ways to apply it, and for this to spread across dentistry like wildfire. Because I think that's what we're dealing with is a real game-changing idea here. So I would like to thank everybody for joining us and hanging with us for close to 45 minutes here. And we'll look forward to our next interview with more interesting people that are making tremendous contributions to dentistry and healthcare.
Good. Yeah, Emily, can I have you just give us the how do we contact you? How do we? I'm going to put it on the screen, but just say to us how we get in touch with you.
Sure. So it's emily.stein at primaltx.com, which is PRIM as in Mary, AL, T as in Tom, X as in X-ray.com.
Wonderful. Well, thanks, everybody. And what a very interesting and dynamic conversation.
Thank you guys so much.
Yeah.
All right. Thank you.